Okay, it's the turn now for the muscles that are crossing medially from the hip bone to the femur. So, and they form the medial compartment of muscles of your thighs. So they're located right here in the medial compartment. What is the action? Remember when we were describing the cross section of these muscles by compartment? The action of all of them, a common action, is to adduct the thigh, not the leg, only the thighs. They do not attach on the legs, just on the bones of the legs, just one of them. We'll describe them later. But the thing is that we have adduction of the thighs. We cannot adduct the legs, okay? And by compartments, when we were studying this before, we said that most of these muscles are innervated by the obturator nerve. So let's see these muscles one by one. In this group, we have pectineus, 3 adductors, and gracilis. Pectineus, adductor longus, brevis, magnus, and gracilis. Longus is long. Magnus is where you're big. Okay? You're tall. That's longus. You're big. That's magnus. Okay? And brevis is a smaller one, smaller than longus. Now, most of them, actually all of them, has their point of origin somewhere. I don't care where, but somewhere at the pubic bone. Okay, somewhere there in the pubis. All of them, the 5 of them. But the adductor magnus, besides, we're gonna add here one more point of origin, which is in the ischium. It originates in the entire pubic rami, ischial ramus, and ischial tuberosity. So it goes from anterior to posterior, all of this. Okay? So those are the origins of the 5 muscles. See how we're grouping everything, Let's put them in the same bag. Let's see the insertions of those muscles. So they start in the hip bone, the pubis, and on the ischium. And from there, they go to the femur, most of them. Let's see what part of the femur. And I brought this picture because I know that I'm gonna be talking, you're gonna be like, what? This is the posterior aspect of the femur. Posterior, okay? So you can see here the condyles. This is the medial and the lateral condyle. Here is the head of the femur, and this is the greater and the lesser trochanters. You with me so far? We said that here only on the posterior aspect of the femur there is a ridge, right? That we call the linea aspera. And this ridge has like 2 lines. I don't know, it goes, it is this one, like a Y, letter Y, and 2 down here that you can see it. See? Woo. Name of these things. In the midline, not in the midline, in the mid shaft, this is the linea aspera. Then we have 2 lines. The one towards the medial line, and it makes sense now because it's towards your pubic bone. That's the pectineal line, because there is where the pectineus insert, right here in the pectineal line. The other line, we're not going to cover it so far, but it's the gluteal tuberosity. We will cover it in the next group of muscles. Okay? But so far we know, okay, we're in the back of the femur, posterior. So we look at these muscles. They start anteriorly in the pubic bone, and then they go like in a posterior, like in a diagonal, to insert behind the femur, on the posterior surface of the femur. So right here in the pectineal line is where the pectineus insert from the pubic bone. The adductor longus, again, it comes from the pubic bone and inserts right here in the linea aspera, both the longus and the brevis, okay, in the linea aspera, somewhere here, the proximal aspect of the linea aspera. Now, look what happens with the adductor magnus. That, remember, adductor magnus, you're pretty big, is pretty big, okay? So in that, you're gonna add one more origin. It's the entire pubic bone and almost the entire ischium, okay? All the way to the ischial tuberosity, back there, okay, where you're sitting on, remember? In all of that, so from anterior to posterior, all of that is the origin. And look at the insertion. It inserts right here in the linea aspera. It's an adductor. Which way are you going to go, laterally or medially? You're going to go medially, right? So you follow all of these supracondylar line, supra above the condyles, supracondylar line, the medial supracondylar line, and from here it like it skips and inserts in this tubercle that I hope you remember is called the adductor tubercle. Okay, so adductor tubercle. Now, I'm gonna go back one more time so I can erase all of those things. Okay, so look at the adductor magnus, how it looks like. Okay, this, from here to here, this is the pectineus, okay? This in here, they cut it. They cut the adductor brevis, so we can see behind that, or deeper to those muscles, we can see, I'm sorry, this is not pectineus, guys. This is the longus. I'm like, I'm disoriented. Pectineus is gone. This is the brevis that they cut. This is the adductor longus. And behind that, we can see all of this is the adductor magnus. All of this muscle, okay? But you will need to do the same thing with the brevis, with the longus. Cut it, you know, retract these two or separate the longus so you can see the entire magnus. It's all of that, okay? Remember, I'm including longus in there so you can see the shape of the muscle. That's why it's called magnus. And it leaves this opening in here that we called the adductor hiatus, and is where we will see on the lecture, the femoral artery passes from being anterior to posterior to go behind the knee as a popliteal line, artery. Okay, so you have there the pectineus from the pubic to the pectineal line, the adductor brevis from the pubic bone to the linea aspera, adductor longus as well from the pubic bone to a broader insertion in the linea aspera, posterior to the femur, the posterior aspect of the femur. We have the adductor magnus from the pubic bone and ischium to the linea aspera, supracondylar line, and adductor tubercle. And last but not least, and it's not shown in there, we have another muscle that originates also here in the pubic bone, and this one spans the hip joint and spans as well the knee joint, and it has almost the same insertion as the sartorius on the medial posteriorly side of the tibia, right below or inferior to the medial condyle of the tibia. So if it has the same insertion of the sartorius, well, you can understand that this one can flex the leg, okay? It's the only one from the adductor group that can flex, well, and actually also medially rotate the leg. The rest of the adductor muscles, they have no attachment on the bones of the legs, so they have no actions on the leg, okay? So the actions of this group of muscles, all of them adduct the thigh, gracilis also, the 5 of them adduct the thigh. All of them except gracilis, they can flex the hip because they're crossing kind of anteriorly also the hip joint. See, not the hip joint, but from hip bone to femur. Uh, and they are doing this on an anteromedially fashion way. So they can flex the thigh, they can adduct the thigh. Adductor magnus is such a big muscle that the anterior fibers can flex the thigh, the entire muscle can adduct, but the posterior fibers can extend the thigh. Okay, so those are the actions of these muscles separately. All of the muscles again are innervated by the obturator nerve, all of them. The thing is that pectineus, the first one, sometimes can be innervated by obturator nerve, usually is innervated by femoral. And adductor magnus, again, such a big muscle, it has two nerves. It has obturator, but it also has sciatic nerve providing this muscle. Obturator for the anterior portion, sciatic for the posterior portion. Okay, I don't think I have anything else in there, but I'm going to show you my super duper app. Okay, let's be oriented in here. I'm gonna go there to the anterior thigh, and in here we have described so far this, which is the sartorius. Are you with me? Yes? Crossing the thigh on a diagonal from lateral to medial, from superior to inferior, right? See that the sartorius kind of divides the thigh into this, which is the anterior compartment, and this, which is the medial compartment. These one are the adductors, and these one are the extensors of the knee. Now, let's keep describing in here. I have there the sartorius. This is the sartorius. Do you agree that this looks like tensor fascia lata or latte? See, how do I know? Well, because it's inserting in the iliotibial tract or IT band, right? What else have we described? Well, the other ones, we cannot see them clearly here, but I don't want you to get confused with this. Look at this. In here we have, this is the iliacus, and this one is the psoas major. Okay? Now, after the psoas major, these are the group of the adductor muscles. The first one is the pectineus, then the adductor longus, and this one, I'm going to turn this picture, but I think it's the gracilis. I need to turn the thigh a little bit just to make sure. It is the gracilis. So this is a medial view. Look in the medial view. Again, this is the sartorius. Always use the sartorius as your point of reference. So in here you can see this is the psoas and the iliacus. Here I can barely see the pectineus, part of the adductor group. So this one is the longus, adductor longus. Look at the gracilis. Remember I told you it has almost the same insertion as the sartorius. So the sartorius gracilis, guys. This is gracilis. Gracilis with the same insertion as the sartorius, spanning the knee joint. Now, I'm going to remove a layer. What we can see in here, we removed the sartorius, so we don't have that point of reference anymore, but I know all of this is the quadriceps, is part of the anterior compartment. So this one, since it's going from the pubic bone to the tibia, I know that that is gracilis. That's the importance of knowing your origins and insertions. Okay, I'm going to remove gracilis. Again, we can just see in here, see, pectineus, the longus, and what is that? And gracilis. Still, we're seeing gracilis But what I want to show you is magnus. Okay, I'm going to remove one more layer, and still we're seeing the same muscles. Sorry. We're seeing pectineus, adductor longus, gracilis. Let me turn it around so you can see it's gracilis. And this one still, I want to get there. Okay, again. And again. Okay, look at magnus. This is the pubic bone, all of this, okay? So see that they all originating here, pectineus, that might be pectineus or brevis. I need to remove it to see. This is longus. This is the one that forms the hiatus. It's called adductor hiatus. No, I don't have it, but I think it's spelled like that. Hiatus. The one that creates that is the adductor magnus. Look how this is on the medial side. Do you see how broad the muscle is? So from pubic bone anteriorly, look at the ischium or ischial tuberosity to the ischium. All of that is the magnus, inserting in the linea aspera, supracondylar line, and adductor tubercle. All of them, remember, innervated by the obturator nerve. To the magnus, we're going to add to the adductor magnus, we're going to add to the obturator the sciatic nerve. And through the pectineus, it can be either femoral or obturator. Actions of all of them is adduction of the thigh, all of them, the 5 of them. The thing is that pectineus, adductor brevis, longus, and magnus, they also can flex the thigh because they're crossing anteriorly the hip joint. Gracilis, since it's so medially located, it cannot flex the thigh. It only adducts the thigh. But since this one is crossing, gracilis is crossing the knee joint, it can flex and medially rotate the leg. I think we're done with this set of muscles. See you in the next one. I know my muscles now. The next video, we're going to talk about the anterior compartment of the thigh. See you.